I'm ready. Hello, my name is Arielle and this is my WRD111 solution speech. Today I'm talking to you on the topic of gentrification and health. This topic has had little to no recognition over the years. When it comes to the health and well-being, the gentrification process can hurt the people who live in the neighborhood. The people who live here often have various underlying physical health issues from poverty and the lack of access to health care, as well as the conditions of the neighborhoods in which they live in. However, gentrification can often promote the community's physical well-being through land development. Even though gentrification brings an influx of money to impoverished neighborhoods, there is not always a positive side to this. We need to utilize and update the land already available in the community and create access to affordable health care for those below the poverty line by assisting smaller clinics that are already established, on top of creating programs that will work with the current residents to afford treatment in already established hospitals. This can be done by attempting to work with the people that are in the community, getting their input on the topics that can impact their community greatly, to their advantage, to help people understand the needs of their community and how they can work with them to develop the community in different areas without displacing the current residents, to make a place where everyone will want to live and be able to live together. One of the articles that I have included discuss how the gentrification process can be positive for the people moving into the neighborhood more so than those already there. This article goes on to talk about how and why most urban reconstructions that were put into place to help the people get access to these things they need can end up hurting the same people that they were put in place to help. There is a lack of research that directly links to gentrification minority health outcomes. They address this gap in the individual data from the 2008 Philadelphia Health Management Corporation's the South Pennsylvania's Health Survey and the census data from 2010, as well as the American Community Survey from 2006 to 2010. This study provides recommendations to tackle the serious urban health issues, perceived pathways, the study of tourism, gentrification, and health. A study done in the Gòtic neighborhood of Barcelona in 1982 says that you should be able to communicate with the people living in these neighborhoods as well as the people who are going to develop here, and that tourism gentrification is currently the most severe health problem in Barcelona. This study identifies various pathways between tourism, gentrification, and the wellness. They use participatory action research to benefit, support, and empower the people of these communities. By using participatory research, it would be utilized to allow residents to feel more included, like they have a voice and change in their community, where they spend most of their time, money, and where they have planted roots and built families and over generations. It also allows them to feel connected, that they have a voice in their government. Ideas like surveys and townhouses, where the people of the community meet with lawmakers and develop more important issues when it comes to changing these communities. The residents often feel like they have a voice, which is unlikely and normally in most of the cases when it comes to gentrification. The Association of Minority Self-Related Health with Black versus White Gentrification discussed that there exit controversy as to the influence of gentrification in the cities that have on welfare of minorities. Accused gentrification of the causation of wellness disciplinaries for a deprived minority population residing in the neighborhoods, changing due to socio-economic shifts in the American economy, often displace different people in the gentrification process. This can also lead to hospital closures and clinic closures, where people often use to go to get wellness. With this understudy implications for someone's wellness and health protective residential area resources for low-income and minority residents. They often use these clinics and hospitals to get their income they're able to use emergency rooms in order to get the patients seen even though they don't have health care. Increased observation and wellness inequalities propel questions on the correlation between gentrification and wellness. Nevertheless, this is still an important unsearched topic that people often overlook when it comes to gentrification. Gentrification is normally a vital change that can be built into communities. The problems that come from gentrification have yet to be tackled or completely understood. My name is Arielle, and this is just a little knowledge on the understudied topic of health and gentrification.